Good evening, everyone, or good afternoon. So today we're doing part of photorejuvenation treatment. Of course, we're not doing all of it as we have half an hour together today. I have prepped my client, my model skin right now. So I have cleaned with the Dermaless cleanser from Action de Gala. So I did two cleansing to make sure that no makeup was left on her face. When we're doing skin rejuvenation treatment, that's really important because if some pigments stay on the skin, you can burn your client's skin during the treatment. I also use the micellar water to remove her eyes makeup, make sure that I'm removing everything so I don't have anything that's sliding out of the high patch during the treatment. I follow it by the Tonicate, once again by Action de Gala, to refresh the skin and be ready. I, with a white pencil, contour her brows. I'll just make you turn a little bit like that. So to make sure that I'm not capturing any of her hair during the flashes, as well as her lip contour as well. Same thing, I don't want to create any removing of the pigmentation around the lip area, so that's really important. So for right now, that's what I have done. I have positioned in place the two eye protector for my client. They are white, so once again, they're protecting, so I will be able to come really close to the eyes and work on the on the aging sign. On that client, we're more into the preventive way, as she don't have a lot of wrinkle, only a couple of fine lines that we can come and work to stimulate. So that's what we will do with our model today. So to start, I'm working with the Apilux 3G, which is our latest model on IPL devices. When you open the screen, you get all the selection of the different treatment. You have choice between hair removal. So for the one that was here during the first demo today, we did hair removal treatment. So that's one of the options. Today we will look into the skin rejuvenation, but you also have pigmentation, vascular treatment, acne treatment, and wrinkle removal treatment. So for all of those treatments, we working with the IPL interchangeable filter end pieces. So the end pieces look like that. The size of the crystal, it's smaller than the one we got for epilation. So that make it really easy to go, don't be scared, to go really close of the upper lip. You didn't see well there. So going really close of the upper lip, around the eyes as well. So to make sure that I have enough space in between the brows and stuff like that. So having a smaller hand pieces for the skin rejuvenation is really helpful. It got interchangeable filter. So here's a little part where you insert your filter. Each filter comes with a different wavelength. The wavelength is the penetration into the skin. So it's the wave of penetration into the skin depending on what you're treating, rejuvenation, vascular, pigment. You will have different wavelength, and they are, in matter of fact, of different colors. So that's the one for rejuvenation. As you can see, it's pretty yellowish in color, which is exactly what we get, what we need. It's a 560 nanometer. Position it here, but we also have the different one. I'll just show them to you quickly. We got here the one that I don't know if it's clear on the screen. It's better usually when we have white on the back. So this one is green in color more. So that's for your vascular treatment. The one for the pigment, it's orange in color, and I'm just putting the towel there to make sure you're seeing a little bit more. I know that on the screen it's harder. So here it is. The pigment one is orange. I will start by applying the conducting gel on my client's skin. So it's a water-based gel. It's a contact gel that will make sure that the light will circulate, but also to protect the skin, to hold the skin, so to make it comfortable for my client. So I am applying a thick layer Just warning my client that it's cold because it is really cold. So right now I will apply only on one side of her face because of the time frame we have together today, and on the vision for you guys, even if I'm treat on the other side, you won't see. So I'm just doing one side of her face. I'm coming really close of the eye patch. Make sure I have gel everywhere, as we sometimes have a little bit of vellus hair around the contour. If they are dark, make sure it is really covered with your headband. But if you have a little bit of vellus hair here, really important to have a good layer of gel so it's not any pinching as sensation for your client, making more comfortable. Around the lips, and I will end up with the nose. Here we go. So now that I have my gel everywhere, I will be ready to start. Put on the eye protection for me. No trouble for you guys as you're over the screen. There no wonder for your eyes. You're all safe. As I already said, I'm using the small interchangeable filter and pieces. This is a yellow filter for skin rejuvenation, as that's what we're doing today. Also, one thing that is interesting on that device, I have a double security for the impulsion. So I have the foot switch as well as the bottom on the side. So I need to have both pressed down to have the impulse. So that's really safe when you're working to have those two security. So I'm choosing the skin rejuvenation treatment. I'm working with my second handpiece, which is this one. I have done a consultation with my client prior to start the treatment with you. So she's a Fitzpatrick 3. I will go with medium into the intensity, as we are more into a preventing treatment with my client. And that will give me 3 sets. Okay, so all the modality you're selecting, we're suggesting you preset. We're doing training with the device. One part is online for the theoretical part, and one part is in our different facility for the hands-on training. And we explain all of those modalities with you when we have to select this and when we have to select that. So that's something we're covering fully in the training. As right now, what I can explain to you though, it's the cooling system. So we have a thermoelectric system, a Peltier effect around the crystal here. The Peltier effect can go to -4 degrees Celsius, but you have different level, which make it really interesting because it's not everyone that need -40 degrees Celsius, and it's not for all application neither. So really important and interesting that you're able to control the cooling system. So with skin rejuvenation for my client today, I will go with only one snowflakes. So only one thermoelectric system that will just help my crystal to stay cool without giving a cold sensation on the skin of my client, because I really just want to have her real sensation about the treatment. Here we are. So I'm ready to start. I will start by the bottom of her face and coming up. Here we are. And as I'm going, I'm overlapping slightly to make sure I'm covering the part that is covered by the thermoelectric system for the cooling effect. Okay. So I'm just asking my client to make sure that the heat sensation is okay for her. As she said, no heat sensation, really slight sensation. Skin rejuvenation treatment is a stimulation of collagen and elastin fiber. We go in the dermis with the light and we stimulate the fibroblast or the fibrocyte. So it's the cells that are responsible for the production of collagen and elastin. So if your client is in pain during a IPL treatment, that means you are over 60 degree in the tissue. Being over the 60 degree in the tissue means you're creating collateral damage to your collagen and elastin fiber. As what we want right now, it's to stimulate her fibroblast fibrocyte. So we need to be around 40 to 50 degrees Celsius in the tissue to be able to do that stimulation. So really important to really go with the sensation of your client. It should be warm. Yes, absolutely, we're creating a stimulation, but it shouldn't be burning and it shouldn't be pain for your client. You should feel a sensation, but no pain. Going. Always make sure you have full contact with your client's skin when you're doing the treatment, to make sure, I'm sorry, a little bit of gel there. So to make sure that the full contact is really important. So that's to make sure you're not burning the skin. If you don't have full contact, you have risk of burning your client's skin. So I will keep going with her forehead, half of it. So when I'm closing the brows, I'm putting my finger over top of it to make sure, even if I cover it with the white pencil, I want to make sure we're not touching any of her pigmentation on her brows. If your client have permanent makeup or micro shading, needling, blading, all of that, make sure you cover it fully. You can even cover it with a little gauze or stripes to make sure that you're fully covering it when you pass close to it, because pigment will burn with the IPL. So the skin rejuvenation pass for her face is done. I'll just tap my device here. I will reapply gel around her eyes area, and I will go more into detail with the wrinkle-free filter. That will help around her eye corner. As I said, my client doesn't have a lot of wrinkle on right now, but it's more as a preventive way. So I will come and work on the pro feet underneath the eyes as well. Here we are. So I'm coming back to my selection screen to go with wrinkle removal treatment. I'm still with my second hand piece. I'm still with my skin rejuvenation filter, which is the yellowish one. My client still Fitzpatrick tree. That doesn't change overnight. And we will go with medium intensity, as once again, she doesn't have a wrinkle. We're more in preventive way. So here we are, and we will restart for the contour of her eyes. Each application will have their way of working. That's part we're seeing in the training. So as you can see right now, I'm overpassing twice the same places. That's totally normal. That's what I want. Same thing with pigmentary spot and vascular. The section won't be the same. There we go. Perfect. So I'm always looking at the skin reaction to make sure I have no redness or big bright red tissue, to make sure I'm not over treating. Really good. I have a slightly pink effect right around the corner of her eyes where I have worked more. For the rest, it's really slight sensation. The heat will stay in the tissue within 72 hours after the treatment. So really important that after care, your client is not going to hot showers, spa sauna, anything that will bring direct heat to the face. It's not a good idea for the next 72 hours. those 72 hours, we really need to calm the skin with non-occlusive product, because if we're using occlusive product, then the heat will stay in the skin, and that's really not what we want. As we're stimulating, right after the treatment, usually the clients see a lot of brightening effect in her face, but not so much of the good result we're getting. Usually we will get those results up to 72 hours after, up to 21 days, because we need the time to stimulate those fibroblasts and fibrocytes. So we will see effect happening up to 21 days after the treatment. So that's important when you're doing those kind of treatment, to do before and after picture, to really notice all the difference and all the positive effect gained by the treatment. Here we are. So I'm removing the excess of gel. I will go with my Tonique Restore Lotion by Action Gala once again. Remove the excess gel, and I will go with a little bit of micellar water to remove the white pencil on her brows as well as on her lips. Then we will proceed with a quick mask. I will apply the mask on my client face. Here. So for her today, what I've choose for a mask, it's the collagen eye mask, as it's the zone I have treated the most. So that's what I will be using. And for the rest of her face, I will use the Jouvencel mask, which is a gel-based form mask. Really important, as I said, I don't want anything that is occlusive after the treatment, to make sure that the heat doesn't stay in the tissue. Here is my collagen sheet mask that I'm applying right there. I'm wetting the tissue with the Tonique Restore Lotion once again. So I can do it with a little gauze like this. For the eye area, I like it a lot. You can also do it with a brush. So even if I haven't treated the other side, I will apply the collagen sheet mask on both sides. It's nice for the client, right? Here we go. And the Jouvencel mask for the rest of her face, which is a nice gel texture mask with rejuvenating propriety. There we go. Just warning my client about the fact that it's a little cold. And once again, I will do both sides of her face to be nice and even out a little bit the treatment we have done. There we go. So for skin rejuvenation treatment, we're able to do skin rejuvenation, wrinkle, also all the pigment area we can work on. We're working also on vascular, deep wrinkles. So it's really versatile device that will help you to go and work on different lesion and skin anomaly to help with your client. You can treat let's say skin rejuvenation and a little bit of vascular in the same treatment, or skin rejuvenation as well as pigmentation spot in the same treatment. So the client doesn't have some time to come multiple times. They can come one time and we can treat all of that. Of course, we're working more into cure sessions, so more than one session. But with the intensity of the treatment we doing, you have just had a bit of it right now. Usually we spreading every 21 days, so the time that the skin rejuvenating and that we have the full on result before we treating again. So for a pigmentation spot, what we do in fact, so let's say we have a pigment spot on my hand, we will make sure that only the pigment spot is uncovered. So I will use little white stripe to make sure that only the pigment spot is uncovered. And then I will go with the pigment treatment and go and flash on them, which will create a little burst out of the pigment. Okay, so it will fractionate, it will crystallize, just like water or a window on the winter where you can see a little spreading of more brown pigment. So your client needs to be warned to don't go to the sun after to any of the phototechnology treatment. They shouldn't go to the sun at all. For a pigment have a memory. So if they expose themselves to the sun after, it will for sure come back. So that is a must. Your client needs to know they cannot go to the sun. They have to apply sunscreen after you treat a pigment spot. For the vascular treatment, once again, pretty similar depending on the type of vascular lesion you're treating. You will flash it to make sure you create a coagulation of the precapillaries, or again, the ruby angioma, so whatever you're working on, to actually have a full coagulation of the anomaly with the heat from the IPL. So yes, we can combine it to other session, let's say peel, micro, and stuff like that. But we need to be careful because with micro and peel, that create a skin sensitivity. So once again, they need to be 21 to 28 days apart before you can treat with your axis. But that will really depend on your client's skin. So if they have really thick skin, dull complexion, and they really need a peel or a micro, we can do session of peel or micro. Then 28 days later, we're doing IPL for skin aging or for pigmentation. So what so on, depending on who you're treating. So yes, you can combine it to other technologies, to radio frequency as well, in like alternating to maintain a result that you obtain, but also to get where you want to be, because you will have different sensation and different way of working on the wrinkle, on the vascular, on the pigment than other device. Same thing then with thermocoagulation, that can be a good add-on together. So you first doing the IPL to remove the bigger capillaries, precapillaries, and then you finish up with the thermocoagulation treatment to have the best possible treatment. So the combination or multiple solution that you can do, really depending on your client. And that's something during the training that we go over also with the different session more in detail, of course. Have a good day. Thank you very much, everyone. And see you soon.